And Zane from RPH Ally. We're really excited for a fun episode today. A little bit of wordplay and a little clickbaity, okay, with the AI will replace us, time to find a new job. But is it entirely, Zane? I'm not quite sure. I'm going to click the reel and we'll jump right into it. So is the big bad AI robot coming after my job here sometime, Zane? Because all the pressure from big time pushes in ChatGPT, some recent news with some statements being made by ChatGPT, and other AI, natural language processing, groups coming into the medical world or thinking they can disrupt it. Where do you think we are? What have you kind of written about previously in Digital Thoughts?
Definitely need to find a new job, guys. It's over.
Bye-bye. Have a good one. Good night.
No, so my article was really tongue-in-cheek that I wrote about it. It was how I would replace myself with a robot. And there are things that, so basically I highlight everything that I would do and automate all the things that I would automate. And then it kind of crescendoed into, well, it's great you automate all those things so I can take care of patients, talk to them, do all the MTM services that I want. That you cannot automate. So we kind of discussed this. So Sam Altman is the CEO of OpenAI, which created ChatGPT. And he, in a recent interview, I don't know the interview you're talking about, but I'm just talking about a different thing. He, in a recent interview, said that sentient AI, meaning AI that can kind of think for itself and learn on its own and all that stuff, basically have a human brain, is a little far away. And I agree with him. So if that's far away, I don't think it's going to replace us as the medical profession anytime soon. What I do think it can do is, maybe have like algorithms for, there's a company out there, I forgot their name right now. It's can't think of it right now, but basically they created an algorithm. It's not an AI, technically it's algorithm, where you kind of go through, like, say what symptoms you have, and it'll tell you like, okay, go to the ER, don't go to the ER, go see this, go see that. Like, but it's very, very, very conservative. And the only way I see AI really making so there's a couple of things holding AI back in healthcare. It's the data. So AI, if people that don't know, is trained on data. So there's two types of data. There's like synthetic data and then like real world data. Real world data it can't really get because a couple of reasons. It's locked down by EHRs, healthcare systems, people hiding behind HIPAA. The other reason is the data is not clean enough. So it's around somewhere. I read somewhere. I might be a little off by the things, but I think it said more than like 60% of healthcare data is unused right now because of it's either in proprietary file formats or it's just in a state that it's not usable, right? So we need clean data. We need good data, not just like, we need diverse data as well, right? The last thing we also want is from medical community, we talk about social determinants of health and health equality and all this stuff. But if all of our data is skewing to a specific socioeconomic and race, it's going to, compound the issues that we already have in the healthcare system. So that, and then on top of that, where was I going with this? Yeah, so you need good data, and then you need liability, right? So who's liable if the AI is wrong? Right now, we are liable, right? Like if we're wrong, we're liable. So no provider, I shouldn't say no, but very few health systems and providers and such are going to be like, yep, yeah, we'll just, have AI take over the physician, the pharmacist, nursing jobs. But if they're not taking any of the liability, what is it? What are you doing, right? If it fails, then what do you do then? So that's just kind of like my thoughts on it.
No, that makes a ton of sense, buddy. I think that when we have AI will replace us, time to find a new job, like kind of thinking going out there, which it is. It's interesting to talk about things outside of, I know this is the healthcare tech show, but outside of healthcare, there are some instances that there are folks that are rather concerned about how AI could, and specifically natural language processing, could replace things like law. So in a lawyer's office, like, can you find a way to be able to say, I can read through all the legal documentation necessary to tell you if this contract is appropriate, for you, and if it will cover you on these bases, what you should add on for additional documentation, those kinds of things. But as you're mentioning with the data, like the reason why the data is so essential is limiting the number of confounding variables. And so that's one thing that I feel like we underestimate inside of healthcare way too often. And that's why Dr. Google isn't right very often, is that there are a ton of variables and other diagnostics that have to be run for us to be able to look at an individual and actually say what is going to work best for them. And even there, Zane, even when, let's use one example. So geriatrics, my background, oncology, Zane's background. If you looked at a patient and you said, here is what I want to add to their regimen based on the currently available treatment guidelines, what you would end up getting is a very sick patient and you made them sick. Reason is you kept piling on all the guideline advice and not looking at all the consequences of what you were adding to the regimen. And so there's a lot of those consequences that you and I see already, buddy, in clinical practice. And so I think their limitation.
Yeah, no, and I mean, I think that what I would tell if you're like creating an AI bot or something like that, I would tell them don't make something that'll replace us, because it's just not. It's not even at that point right now. AI is just not there yet, right? And stop clickbaiting, stop doing all this stuff. Do stuff that will actually help us, right? Do stuff that like I tell people, don't try to replace us, augment us, right? Help us do our job better. And that's where I think AI will show up in our healthcare system. Will it take away some, I don't want to say low skill jobs, but like those jobs that are like A or B, B or C, right? Like those kind of jobs, or like transcription. We kind of talked about it with the note thing last week, was maybe transcription might be going away. Scheduling could be automated in some cases. Front desk work could possibly be automated. But then, like, instead of waiting for all this to happen, why don't we become part of the the technology evolution process and guide it how we need it to be done, right? Like, work with people that are creating these things and help them guide and shape the way medicine is going to be practiced in the future. Because the last thing, it would be much better to be part of creating it rather than being hit over the head with it, kind of like what happened to us with EHRs, right? EHRs were majority of it was built without too much consensus, like medical like input, right? Even now it's not too much, and we complain about it all the time. AI is going to be, if AI gets to the point where I think it will, it's going to be 10 50, it's going to be magnitudes worse than what EHRs do. So we need to be part of we need to be part of it, right? Because what'll happen is, and we see this in other sectors, somebody will come in, be like, hey, you can replace this pharmacist with this AI bot. Boom. They're like, okay, great. They look at spreadsheets, they take them out. And then the AI bot sucks, healthcare sucks, but you know what? You've already made that transition. No one's going to be like, oh man, we made a mistake. It's just going to, those are things that might happen down the future, and it shouldn't, but we see it all the time in other sectors, and healthcare is simply just another sector that's being turned into everyone just looking at a spreadsheet rather than the person. And that's one of the problems that's happening in healthcare right now.
It is. And I think when you say augment, and like even the title of AI will replace us, I think it will replace us with us 2.0. Like that will be the replacement, because now we'll be able to focus on the things that cannot be run algorithmically, like truly connecting with other human beings, getting the actual human tangible aspects that really do drive the needle in healthcare. And we've got to see real changes that end up happening. And if we start to move toward qualitative measures, which I feel like you and I have heard about long enough that I almost worry that it'll be something our kids will be hearing about too. But I don't think it will, Zane. I do think we're getting closer to the point where fee-for-service models are starting to be broken down a little bit, and we're going to start seeing more qualitative measures go in. And when they do, we're not going to have the same we need to code this appropriately mentality that is fed kind of the EHR engines, and it is potentially the way that AI could go that would be very negative in my opinion. And I don't know you share the same, but instead we'd have the ability to be able to qualitatively say, how do we treat this patient better and allow them to live healthier, higher quality levels of lives, and use the large repository of data within an EHR. And Zane jokes about it. Him and I both like bite and gnaw teeth on it. Is sometimes the HIPAA privacy component is one of the worst things that has happened to healthcare in lots of ways. I agree we need our privacy. I agree. We don't want to just throw medical information out there for anyone to get hold of. But some of the restrictions that it applies to us don't allow us to be able to accumulate large, massive amounts of data so that we can then house it, utilize it, and segment it to the point where we could really power AI to make, Kevin, Zane, and all of you 2.0, that we can make faster, smarter decisions for our patients and then be able to educate them and motivate them and connect the dots for them so that it actually benefits care. So there's my take, buddy. I mean, it's always about how do we utilize it so we get it literally, it feels cliche to even say, Zane, because I feel like every technology company says it, like, we're going to give you more time with your patients, but do they? And I hope that's what we can answer with AI, that it truly does give us more time with our patients.
Yeah, and then like some examples where I would be like, I could see it like, synthesizing our notes, giving, after it looks at our note, and then taking all the lab values together and, all that, then saying, okay, then giving us like a list of diagnoses, right? Like the top 5 diagnoses that they do, right? And then you can, and like, again, this is augmenting us, this is helping us. It's writing the note for us. It's kind of helping us down our differentials. It's looking at different labs. It's flagging patients that, you might have a practice that has, 2, 3, you were seeing like 50, 60 patients a day, which is actually, in some cases, some people see way more than that. You're like running, you don't have time to look, labs are being drawn all day, people are calling all day. An AI system can kind of take it all the labs and look at previous records and be like, oh man, this is trending up, this is above the threshold, sending out like reminder calls, reminder texts, it's segmenting your population with high risk, low risk, medium risk, and it's reaching out to those high risk people and making sure everything's okay. Like those are things like AI can do really easily right now, but it's just like not sexy. I mean, there are obviously some limitations to it. Again, there's a data issue and all that stuff, but those are things like I think they're going to happen very quickly, and
Totally.
that's what's coming down the line. And to me, that's not scary. For some people, it is, because it might be removing their job. But you know what? If you're in that position right now, and I mean, it's very easy for me to say this because I'm not in that position, but you need to know these things are coming, right? Because last thing you want is like, boom, hey, we need to like start expanding what we're doing. And but yeah, I mean, we shouldn't be fighting it. We shouldn't be fighting that kind of stuff. We should be embracing it because it will help us if done properly.
Examples, I think that, reading the other day, I was reading an ISMP article, all about medication practice safety. And usually I'm thinking for Zane and I, we've looked at ISMP on the hospital side of things, like what are best practices? Where do we encounter errors? Where do we encounter issues? And this one was about the community pharmacy like space. And what are the most commonly like encountered errors and issues? Utilization of tall man letters, storage of units, et cetera. Being able to incorporate AI into like, here is the most commonly like introduced medication error for me as a pharmacy mind, or just general medical error for anybody in healthcare. Like, that's where we could really have it start flagging us and saying it is 70% likely that someone that does this kind of process may run into an error. Here are things for you to be able to check. Like, that's beautiful, Zane. Like that, just that alone makes us better, safer, and we shouldn't be scared of it because it could save us from a huge lawsuit on the other end.
AI can also do transition of care, right? You could be using transition of care. Like you have a list that they came in with and a list that they're leaving with. AI can kind of run through it, make sure there's not duplication of therapy. You can put in different things like, hey, if this person's got diabetes or whatever, like, okay, if they're on like 10 medications, if there's like a differential of like 4 or 5, like there's like so many things you can do. And that's where AI can help us as well too, right? I mean, and then also with dosing renally adjusted meds, like AI can easily be doing that because 99, I mean, it's probably almost every hospital out there in the system now has algorithms that we have to follow, and you just have to follow them, right? I mean, there's very few that fall out, and AI can take care of the ones that fall right in that algorithm. And then whatever falls out of it, the pharmacist or whoever's taking care of it can take it. And then guess what? With every single thing that's out of range, it'll keep track of, okay, this is what was happening, this is what happened. And then its scope can keep increasing and increasing because the more data it gets fed, because then it can look at, okay, this guy was 80 years old and they went lower on the dose, and this person's BMI was this. Like, it can do all these things in a fraction of a second, where we are like sitting there freaking out because we don't want to like. But I mean, like I said, most of it is just algorithmic, right? Those things are algorithmic. And again, those things take up so much time. TPN, right? Writing up TPNs, things like that. Like things that take so much time, but they're very algorithmic and they can be done. and I think AI can take over that, and then it can really free us all up to do things, right?
Yeah, so maybe the finding a new job is just finding how to benefit healthcare long term. Well, thank you all for coming on the ride with us with AI. If you have any thoughts or any other conversations you'd like Zane and I to have kind of along the way, or have some more expertise and want to join the fun sometime, then let us know. Do remember that we have a pitch competition coming up. So we send your applications in. You know, Zane and I will put it in the show notes. Zane puts it on all of his posts to be able to grab onto that. So we look forward to you guys going there. Check out all of Zane's stuff on Digital Thoughts, and then go to rphally.com and join the healthcare technology channel too. And you can join the conversation. Zane, any parting words, buddy?
Nope. Just, run for the hills, guys. No, I'm kidding.
Run for the hills. You're gone.
I'm kidding. All right. Well, you guys have a good day.
Talk soon. Bye-bye.